talking about research that we really did like last year in like May, June, and July. So, but this stuff is still relevance for now. But we haven't really done much in that area, particularly for COVID-19. So basically, what we tried to look for, like back then in May, June, and earlier, there was like this race. There was always this virus around, and you would not, if it would attack you, if it would actually, if you would contract the virus, it really became a race between between the virus and the immune system, right? And the milder dose, it was better, but really a strong immune system was key if you wanted to survive that. Okay, so here is like some risk factors actually that indicate weak immune system that would make you more vulnerable to die or get at least seriously infected by this COVID-19 coronavirus. Lack of sleep is one, anxiety, stress, low vitamin D, excessive alcohol drinking, poor nutrition, poor health, excessive smoking, lack of exercise, all of these things that are like weaken your immune system and make you more vulnerable to this disease, right? So if you have a strong immune system, maybe you make it, right? Even if you get infected. And these things actually are captured by the CDC, Center of Disease Control, Social Vulnerability Index score. So that actually, there's a lot of these variables that you can get from the CDC that gauge the potential negative effects that you might have on a community level. It's per county usually, that when there's like some sort of a stress comes up, like a natural disaster or a disease like COVID-19. And this is a map they made, so you can already see like where the areas of high vulnerabilities are in the United States. And they're really four general themes. There's socioeconomic theme, there's housing composition and disability, minority status and language, and housing and transportation. So there's these four general themes. And we collected 242 variables from these, like for 3,008 US counties. And they include like percent children in poverty, percent population with insufficient sleep, median household income, suicide rate, hospitalizations, overcrowded households, DUI, fatalities, life expectancy, and on and on and on. So there's all these factors that you can see there are expressed numerical values, and you can mine them, right? So that's what we did. We have a software that we have that will find interesting patterns in data where patterns are described in the native language of the domain. Like they're not like abstracted away like a neural network. Basically, you would know exactly what these patterns stand for. And they're usually very low dimensional, which makes them easy to explain. And we call that explainable AI. Well, we don't just call it, this is generally known as explainable AI because it can be explained well. And once you see these, you can get a better understanding of the process that's hidden in the data, and you get a good AI model that you can trust because you understand it. And eventually, so each pattern really, as I said before, is like a subpopulation, the high dimensional feature space. Each of these variables, 242 variables, they construct this high dimensional space. And these patterns are subpopulations in space. And they are conditioned by that these data items that are in one pattern are basically similar in a set of relevant features. Not all features, just a set of relevant features. And it surprisingly is very low dimensional. And also the other condition is that the data items in these patterns have on average unusually high or low values in some chosen target variable, in this case, COVID-19 death rate. So let's go like to COVID-19 and actually see what this looks like, right? The goals were really determine why some US counties experience higher death rates and get a better understanding how this really happens, right? How this disease gets communicated. Then help people predict future COVID-19 death rates and also see some interesting correlations, and help with the allocation of resources, aid in target community-based information campaigns, and also maybe inform insurances to forecast risk and demand, right? Stuff like this you can all do because now you have these patterns, you can compare them. So we use this data set and merge them with COVID-19 statistics, which we update regularly. And we automatically identify 297 patterns, okay, sets of counties in May, which had higher, most of them higher than US average COVID-19 death rates. And they're usually described by 2 to 3 features. So let's see a few examples. So now it gets a little technical, but it's all visual, so it should be easy to understand. So what you see here, each of these purple dots and yellow dots is one county, one US county. And the axis is the county poverty rate. In this case, one variable is the county poverty rate, and the y-axis is the COVID-19 death rate on a log scale. Okay, the higher, the more death rate there was. So you can see these up here, these two counties have very high death rate. And this, you can see this dotted line here. This dotted line here is the death rate average over all US counties that had a death rate that was greater than 10. Otherwise, it becomes too low, right? So just all the relevant counties, okay? And this gray box here are the counties in a pattern, okay? Where the solid line indicates the average death rate of the count only in this pattern. Only in this pattern, you can see there's a difference, right? In a pattern, the death rate was higher than the overall average death rate of the United States. But you can still see there's some yellow points, which are points inside this pattern or the subpopulation. There are purple points that are actually not in the subpopulation. So our algorithm automatically, everything's done automatically. You don't have to do nothing, right? You just throw the data in and it'll come up with these patterns. Okay, so no human intervention needed. And it computes in minutes, right? So it doesn't take a long time. And so you need one more variable to tease these out a little better, right? To separate the yellow ones from the purple. So we used what we found out, what the algorithm found out is population aged over 65. Okay, this was with the high, this is the county poverty rate, this is the population that aged over 65, the percent. So this gray box here is all older people in here, right? This is the counties, the aging counties, but counties that have a higher percentage of older people there. See the same counties again, but still not enough. You still see some purple counties surviving. So you need one more variable, and our program automatically finds this. In this case, it's the population density. So these are counties with low population densities, low population. So now everything is yellow. So you can see this perfectly describes these patterns. And when you want to see where these counties are, they're all here. Okay, these are all the counties in the US that have all that kind of pattern. Okay, sparsely populated counties with poor and aging population. Okay, and these counties are characterized by that. So another example is where you can look at percent insufficient sleep. Like these counties here, the gray box, are those counties where population doesn't get enough sleep. Like prescribed sleep, where I think it's 8 hours or something like this. They sleep less. Probably they work 2 jobs or for some other reason. They are more vulnerable, right? Still not enough to describe them, so you'll have to go one more. This is the percent uninsured. So there's a higher percentage of the population is uninsured. That's the second variable that does it. And the third variable we found is percent without high school diploma. So these are the uneducated counties or less educated counties. So now again, you have a pattern that is here. These are also mostly in the South, like sleep deprived people, that low educated and uninsured, right? These are the counties that are marked by these kinds of demographics, right? They have a higher incidence of COVID-19 death. So another thing we did was, this is kind of like the overall alert map we call. These were like all the patterns where the bluer means more higher death rate. So this basically was in May 10, we saw this like this, So it basically goes a little bit with the CDC risk factors, but these have high COVID-19 death rates. So another thing that we've done is correlation to figure out if there's like a linear association between two variables that expose you more to a high death rate. For example, amount of exercise and state of one's health is like one of these correlations. And usually when scientists do correlation analysis, oftentimes they just take all the data points, right? They compute a correlation of one variable over the other variable, and they just use all data points and find out if there's a correlation. But this doesn't really work oftentimes. For example, if you try to find a correlation between severe housing cost burden, like houses, homeowners that have a lot of housing debt, and over COVID-19 death rate, you're not going to see much correlation there at all, right? So there's actually only 10%, so it's very low. So you would think COVID-19, it doesn't really, housing cost burden doesn't really affect the vulnerability to COVID-19. But if you do pattern mining, then you'll find out you really do see a correlation if you constrain your observable interval to counties where the poverty rate is low and the home ownership is high. In those counties, this really is well expressed by 62%. This is actually more like a pretty high correlation right here. And you can explain this, right? These are these people that have to buy a house, but they can't quite afford it, and they have to take up a lot of depth, right? And then they probably don't eat well, or they don't do enough exercise. They maybe still work 2 jobs and expose themselves to all these other vulnerabilities, right? Housing depth burden is not direct a vulnerability, but what comes from it is a vulnerability. So you can just think a little bit beyond this and see how this can be explained. And this pattern mining can really figure it out, right? If you constrain it, you'll expose this high correlation. So these are the counties here. So these are counties, New England, right, up in the East Coast, a little bit here in the Midwest, right? Those are not the southern counties. These are just the counties. One of them is like, Westchester is one of them even. And Suffolk County is another one, right? These are counties that there were lots of people have to buy a house because everyone else buys one, but can't afford it, right? And they expose themselves to the high death rate. So we also find that these patterns are really predictions, right? When you think about it, right? Because remember, I told you they're only on average higher than the US death rate. There might be some of them that are lower, right? So when you look at this, for example, here, when you look at these counties here are below the US average, but they haven't been infected yet, right? They will rise eventually, and I'll show you in the next slide that they will rise. We have shown that when you look at them in May, they were really below here, but in June they were further up. In July they went even further, right? So these counties still have hope. If you alarm these counties, guys, be careful. You are vulnerable to COVID-19 because of these kind of factors that you have. They can maybe be safe, then they can stay here, right? So I'll give you some examples, right? So when we took the May 10 data and then went to June 10 and looked how these counties developed, we found in June 10 there was the US county death rate in June was 24.1 deaths per 100K, and in May it was 16.8, so there was a increase of 7.3, right? So, but our patterns, 98% of the patterns we found, the 9,297 patterns we found went 2 to 3 times more than the US average. They all grew a lot more than the US average. So we had a really good way to predict the growth, right? If you just had listened to these analyses, you could have avoided that maybe. So give you some examples here. So this is the US average here. This is the death rate on the y-axis. This is pattern 1, pattern 2, and another pattern I didn't show you. All of them have had a much higher increase. Okay, much higher increase. Pattern 2 a little less, but when you look from June to July, pattern 2 has increased a lot more, right? So I call it like just catching up, right? So in number 2, it was still a little low, but then, it went up in July, right? So you can also see this very nicely on the map here. Like this is May 10, this is June 10, just in case you don't see it. These guys have come up, right? These guys were not here, and now these counties have gained in death rate. Same thing for the other pattern here. There's some counties here, for example, this and this, that have not existed before, but now have existed, right? So I want to show you a little dashboard that we made in the remaining time that actually allows you to browse this at will, right? You can really just examine these patterns as you will. Now it needs to build a little bit. So let me wear my glasses so I can read. So let's go here, right, for this one county here, Jefferson County in Arkansas. Let's click on it, right? So the color here is basically the bluer it is, the more death rate these counties had. Let's click on it and see what happens. So what we learn here on the right-hand side, we see the COVID-19 death rate in the top panel. The dotted line is the US average, and the solid line is the average that was the instantaneous death rate in this Jefferson County in Arkansas as time went on, right? So it grew much larger than the US average. And here you can see the risk factors. You can see that the percent newborns with low birth weight, these are the top 3 risk factors for Jefferson, Arkansas, for this county. So you can see this is the US average here. This is the dotted line, and the state range is in blue, and the US range is in gray, and the US average is in the dotted line, and the county is in the solid line. So you can see the percent newborns with low birth weight is much higher in that county than even the state is high on the high side of the state range and also higher than the US average. So this is one risk factor. Another one, the life expectancy of blacks is also much lower than the US average, and even on the very, very low end of the state range. Average GPA is also lower than the US average and also on the low end of the state range. You can also look at the pattern itself, which is shared among many counties, as you can see here. You know, the PM25 particle matter pollution is on a high end. The percent adults with frequent physical distress is on a high end. Percent minority population high end. And then you can go and click on another county that has the same pattern, for example, Wayne County, like this, and you can basically just see all the counties that share this pattern. You can also go back to the Jefferson County and then look at other patterns and see what these patterns are characterized by, and just go through it. Right, the more patterns you have, the more vulnerable you are, because you have more and more risk factors. Right, and these are the largest risk factors. So basically, this is this dashboard. Anyone, you can just go to this page here. This dashboard is always online, and you can just look at your about it yourself. So next thing is, so if you have stress, do I need to be afraid? Yeah, you can just simply look at your county if it fits one of the risk profiles. And we can also see, what do I need to do now? Like, can you have to do a lockdown or close the bars, restaurants, wear masks and things like this? You know, depends on other counties. You can basically look what other counties have already done the strategy and then see what would work for you, right? You can also, again, do pattern analysis and figure out the counties that have already done what you do. If you fit one of those patterns where it was successful, then you can just replicate what those counties did, right? So it can also be prescriptive, right, in that case. So that's pretty much the end of my talk. Thanks a lot for listening. So this was done with my students and also with the startup company I have called Archaic Heru. And this was funded by NSF and New York State. And so that's basically all I have to say.